all these and always just put her in the bag. And this lady just kept looking at me and looking at me. She never said anything, but I mean, I don't even put the bag in the cart though. I keep the bag on here. But if they say anything, I've got her card right there. I was like, got my card ready. She started thought, plus I had it on, the thing on her, but it was so hot.
Hello, my darling. Hello, beautiful. You are so sweet.
You saying hi to me.
So sweet. You are the cutest thing I ever seen in my life.
See if I say,
yeah.
No, good girl. Come on. Come on. You can do it. Come on.
Oh, goodness. My God.
Come on. I know you can't back up to that. Can't back up to. She got there just fine.
So
she has no fear of heights. She thinks she's a cat. She jumps off the massage table all the time, and I just fuss at her. Well, she does it like if the cats are doing something, and she can go get it.
Those little legs.
They have her vet doctor is actually chiropractic. I mean, she hasn't seen that often.
Really?
But yeah, he's really cool. I love him. He's out in Oakland. He's an old country doctor. But when I'd taken her in to see him and everything, I told him about her jumping off the table, and he goes, "Oh my gosh, did she didn't break a leg?" And I'm like, "No." So I think she thinks she's part cat, but
he does.
He said, "Well, I'll check her," and he started, doing his little thing here, and he said she was fine. And I said, "Well, how often do they need to come in to be adjusted or what?" He said it maybe once a year.
Oh,
he said it's not that big of a deal.
Not like humans.
And he said, unless there was something wrong, he said no. And he said, really, unless she keeps jumping off tables, he said that, she'd be fine. He said most of them, because I thought for sure she'd be way out of whack or something.
Yeah.
No.
Well, you ready to start?
Well, because we've been going all day doing it.
They're like, no.
No. She don't want to be at home either. Say, I want to get out and play.
I've got the clicker here, and I brought the doorbell back, so if anybody does show up late, I can let them in.
Perfect.
We're gonna record tonight, but you can keep a list of questions while she's going, because you can't answer them at the end.
Yeah.
Yeah,
Okay.
absolutely.
Okay.
Absolutely. And I told several people about it, trying to get more people coming. I mean, it's a great topic.
Yeah, it is.
But
it's a great topic. I know there's a lot of people that need it, but I think a lot of people, if they haven't been here, it can be intimidating or make them anxious to come to a new place.
Absolutely.
That's why we're gonna start recording them though and putting them up on our YouTube channel.
I think that's awesome.
Yeah.
I think that is awesome.
Yeah.
Yes.
Yep.
I think that's awesome. So yeah.
All right. So autoimmune disorders, healing autoimmunity with functional medicine. So my name is Leah. I'm a functional medicine physician assistant, functional psychiatry as well. Autoimmune disorders, either if it's affecting you or your loved one, really tonight just want to offer some insight and some tools, and explore the root causes, labs that we want to look at, just a couple case studies, and then some healing strategies, to help support autoimmune disorders. So yeah, jot down questions as you go. So we're just going to talk about what is functional wellness. I always like to review that because a lot of people aren't really aware what functional medicine or functional wellness actually is. Then we're going to talk about some autoimmune disorders, some specific ones, symptoms, and various labs that we would want to check. And we're going to focus today on how functional medicine can support people that have autoimmune disorders like rheumatoid arthritis, Lyme disease, POTS, and others. Okay, so a little bit about me. I'm a certified PA. I very much believe in holistic medicine. I believe in energy work, mind, body, spirit medicine. That's my passion. And my goal is to practice bio, psycho, socio, spiritual medicine, and help guide others to really find their inner healer, and have prosperous health and stability and joy and all the things. So I really believe in a holistic, integrated approach to mental, physical, spiritual health, and that really underpins my work in this field. Okay, so a little about me. I went to UT Chattanooga. I studied PA studies at Christian Brothers University. I have a certificate of added qualifications in psychiatry. I'm also a professional life coach. I've studied some Reiki. I need to do level 2, and I've done some functional medicine training as well. I started my healthcare journey as a medical assistant, and since becoming a PA, I've worked in various specialties, mainly substance abuse, mental health, ketamine therapy, and now integrative medicine and functional wellness. So, what is autoimmunity? Autoimmunity occurs when the immune system mistakenly attacks healthy tissues. So, conditions like rheumatoid arthritis, Hashimoto's, thyroid condition, POTS, and Lyme disease are really common. So, traditional medicine often treats the symptoms of these things, but not actually the root cause. And so, that's where functional medicine can really change the game. So there's about 100 different autoimmune disorders, and 5 to 9% of the world population has an autoimmune disorder. This is just a list of some autoimmune diseases. We've mentioned a couple already. Lupus is one as well, multiple sclerosis, type 1 diabetes, autoimmune thyroiditis, systemic sclerosis, Sjögren's syndrome, celiac disease, Crohn's disease, and ulcerative colitis. All of these diseases have antibodies that we can actually check to see if it's present or not. And what's crazy is the years that precede the disease actually manifesting physically. I mean, look at this, rheumatoid arthritis, 13.8 years. So you could have it for 13 years, and if you don't ever get checked for it, you're not going to know, right? And so prevention, early detection is really key to really get a hold of it before it starts to wreak havoc on your immune system. Where's another one? 19 years for primary biliary cirrhosis. So as you can see, that's a long time. And these aren't labs that are normally checked by doctors unless there's an absolute reason for it. So some common autoimmune symptoms, chronic fatigue is very common, brain fog, joint and muscle pain, digestive issues, a lot of gut issues, and then just nervous system dysregulation, anxiety, depression as well, mood problems, very vague, overlapping, mental fogginess is a big one too. And a lot of people just go years without a diagnosis because it's just so vague and people aren't really sure what's going on, and they'll see specialist after specialist to try to figure out what it is, and nobody can really pinpoint it. So functional medicine is all about getting to the why of why something's happening. So the root cause. We look at the whole person, genetics, environment, lifestyle, and instead of patching symptoms and, just treating this and that with this medication, we really work with the body's innate intelligence to heal. So it's all about root cause approach versus symptom suppression, and really believe in individualized system-based care. So personalized medicine is really the key. This is just a little comparison of functional medicine versus conventional medicine. So, functional medicine is very health oriented versus disease oriented. We're all about the patient, not the doctor. And we treat people individually because we're all biochemically unique versus everyone the same. So, as you can see, really, it's a completely different way of looking at health and disease and how to achieve wellness. So, some root causes of autoimmune disorders, gut permeability. Basically, your gut is leaky. So, the lining of the gut is not sufficient enough. So, things cross over that barrier that should not, and then they cause issues. Chronic infections as well. So, Lyme disease, get bit by a tick, could not know that something's going on for years later. Epstein-Barr virus, which is really common. Kissing disease is what they call it. Toxic load, so mold, having mold exposure, heavy metals, hormone imbalances as well, nutrient deficiencies, and then trauma and stress. Usually, it's not just one thing. It's usually a mixed bag of things, mixed root causes. Rarely is it one cause for this. You can think of it like a bucket overflowing, essentially. The more that we can reduce that load, the better that the body can actually restore balance. It's a little weird, like looking at you guys and then looking at the camera. I'm like, no, it's okay. It's all right. Everybody. We'll edit this part out. Okay, so Western diet. Is Western diet causing a spike in autoimmune diseases? Absolutely, it is. Look at that. Look at that. Yeah, they've been steadily increasing by about 5 to 6% every year. So in 17 years, autoimmune diseases will have doubled if it keeps at that rate. So genetics as well, genetics play into it. So if you have a predisposition for a certain type of autoimmune disorder, and then you have the exposome, which is the environment essentially, that all contribute to autoimmune diseases. So, there's diet, there's genetics, there's infections, toxic chemicals, and then your gut microbiome as well. And a lot of times it just takes a couple things or one thing to push it over the edge to where it starts to cause problems. So inflammation, very much connected to the immune response. And inflammation really just drives autoimmune flares. That's one of the biggest things that in functional medicine we can really address is really keeping down that inflammation because it's just a vicious cycle between that inflammation and the autoimmune symptoms. So it's like a driver and a result of autoimmune disorders. So when we don't address the source, like food, infections, or toxins, it fuels a cycle of flares, fatigue, and dysfunction. So the gut immune axis, 70% of our immune system actually lives in the gut. Dysbiosis, food sensitivities, and autoimmune disorders, they all play a role. And then, the key really is gut healing strategies. That's definitely usually always part of the treatment plan. Your gut is like your immune system headquarters. So when the gut lining breaks down or the microbiome is off, it confuses the immune system with a pathogen or something that shouldn't be there. So as far as functional medicine approaches, using food and supplements and lifestyle to rebuild that vital foundation is really where the focus is. So again, just a picture of everything that can contribute to immune system disorders. Yeah, I think we've said all of that, but yeah, hormones as well, mental, emotional stress and trauma, absolutely a predisposing factor for autoimmune problems, adrenal fatigue, so chronic stress, which leads to chronic inflammation, and then insulin surges as well. So if your blood sugar is not regulated, that's going to definitely contribute to autoimmune disorders. Okay, so case study. This is a female who presented with multiple autoimmune conditions, a history of. So she came in to me knowingly being diagnosed with Lyme disease in the past, Epstein-Barr virus, dysautonomia, which is very similar to POTS, chronic fatigue syndrome, history of mold and toxin exposure. So some of her diagnosis, some things that we found out as we did her labs, is some secondary hyperparathyroidism. Parathyroid is a hormone, osteopenia, so brittle bones, idiopathic hypersomnia. It's basically similar to narcolepsy, but it's not the genetic narcolepsy. Environmental toxicity, and then also some mild chronic kidney disease. So some things that we found on her lab panels, the parathyroid hormone, which was kind of incidental, but very much is aligned with her symptoms, like the bone loss and the fatigue and the mineral imbalances. And then vitamin D, her vitamin D was really low. We improved that with some supplementation, but her parathyroid was still rising. We saw some heavy metals, arsenic and barium were significantly elevated, and then that history of mold exposure and then current mold exposure that she found in her home. So our approach was to first restore mineral balance, so getting that vitamin D and K2 and magnesium. supplementation going, and then detoxing the toxins. So I encouraged her to go to infrared sauna, use clean water, and then high fiber detox diet. Because of the heavy metals, we're also in discussion about some chelation therapy as well. We're still trying to decide how to approach that. And then focused on movement, really strength and weight resistance is important, especially for postmenopausal females. That's really important to help stimulate hormone production. And then some omega-3s and some other minerals and CoQ10 as well, focusing on hydration, and then sleep hygiene, breath work. Breath work's been really great for her, doing some meditation and just some more emotional awareness and journaling and things like that. So where she is now, vitamin D has stabilized. Her symptoms are beginning to shift. The thing with functional medicine, and when you're really doing it the right way, which is why we have ours set up in memberships, is because it's not just like an overnight thing. It definitely is like slow and sustainable change and progress. And you kind of have to be like, am I getting better? And then you talk through it and it's like, yeah, actually I am getting better, but it's just not like night and day, right? Which sometimes Western medicine, when you get a medication, it's like, oh, I feel so much better, right? It's like instantly, but it's not real and it doesn't last typically. Yeah, yeah. So yeah, PTH, we're still looking at her parathyroid to figure out what to do with that. But she did say she's having a lot more mental clarity, reduced toxin-related symptoms, and her stamina has improved. She's able to exercise more and walk and get outside, and she was not able to do that before. Now, she's still, if she goes hard one day, then she's going to be really tired the next day, but it's so much better than when I first saw her for sure. So still under care and following up on her. This is not an actual patient, but just a case study of somebody with Lyme disease and POTS as well. The focus with POTS and Lyme disease is really just to support tissue repair and IV nutrients, support the mitochondrial health, which is the energy part of the cell, and then nervous system tools like vagal toning. The vagus nerve is really important with people with POTS. Really stimulating that vagus nerve. Yeah, peptides are also an option, a really good option for people with POTS. Ones that really support like healing. Okay. So some functional lab tests to consider when you are looking at autoimmune disorders. GI map, stool tests, really important to look at parasites, toxins, bacteria, viruses, what else? All of that. GI map can really tell you a lot about what's going on in the gut. So super important one. The Cyrex panels are ones that actually test for various autoimmune disorders, all those tests that we looked at earlier. And those panels can get really pricey. And I think that's one reason why insurance and in traditional medicine, they don't check it a lot because, the one panel that tests for almost all of them, I think, is probably like $600 for that test, but can really tell you a lot about what's going on with somebody. So really helpful to get. You can also get more just basic autoimmune tests, like looking at lupus or rheumatoid arthritis. Those aren't, as expensive. Organic acids test is a really cool one because it actually looks at what's going on in the mitochondria of the cell. And it can tell us a lot about neurotransmitter balance. It can tell us a lot about what's going on in the gut, metabolism and micronutrients. It really is getting really deep into what's going on in the cells and can give you a good idea of how to approach that root cause. And then mold and mycotoxin testing, super important. Shirley here had a mold test, so she knows that was really helpful yeah. Heavy metals as well. Micronutrient panel, super important. If you don't have the nutrients there, and anything else that you do is not really going to matter because you don't have that basic support system in your body, those nutrients that just fuel us every day. You're not going to be able to really process, much else. So really important piece there. And then saliva or urine hormone testing or blood as well. I really like the saliva test because it can look at the hormones throughout the day, as well as the cortisol. When you get the blood test, you're really just looking at one moment, snapshot moment in time. So it can give you a good idea of what's going on there. The urine Dutch test is really cool too. It actually gets a lot deeper, and when you look at estrogen, it's not just estrogen. There's a whole, there's like precursors, and there's things that happen after, like all the pathways. So it really gives you an insight into what's going on hormone wise, a lot deeper look. Okay, yeah. Again, just some of the tests that are looking at autoimmune disorders. Okay, so some integrative tools for healing with autoimmune problems, anti-inflammatory, nutrition, diet, 100%. Anything anti-inflammatory needs to be the focus there. So things that promote inflammation, like sugar and gluten and fatty foods and all that, really need to be limited in these people. Also doing targeted supplementation, doing the tests, you can actually see what's going on, and you're not just taking a million supplements because you think that they're supposed to help and you may not need it. Another thing about the micronutrient test that I like to get, it also shows what adaptogens will be most protective for you. So it shows you, what you're deficient in, what you are deficient in, and then what supportive measures will actually be more protective for you, and ones that maybe would not be worth your time because they're not really going to do much. And then IV nutrients and peptide therapy are a really great option. I really like IV hydration therapy. You get 100% of the nutrient that's going in. Since a lot of these people have gut problems, if you're taking things orally, oral absorption is much less than IV and intramuscular injections. But think about if you have something going on with the gut and you're not really processing things, and you're getting much less than that, if any. So that's why I'm a big fan of IV therapy. And then nervous system regulation, super important. Breath work is just like one of the number one things that I recommend to most people, breath work and meditation. But breath work I like because it's kind of like a meditation. You're just focused on your breath, but it's more for your body too, because you're regulating that vagus nerve, you're regulating the nervous system. We live in a society that is just chronically stressed and anxious. And so anything that we can do to slow down and breathe and get regulated is super important. And then detoxification support, of course, we got to get anything that should not be in there out before we really start putting good things in. And, it's a village of tools. It's not about what you take, it's more about how you sleep, how you breathe, how you eat, and how you process stress. So the goal is just to really support all systems that influence immunity. So some lifestyle interventions, sleep and circadian rhythm, of course, get a good sleep routine, sleep hygiene, really important. Movement and getting the lymph to flow. Our lymphatic system can get clogged up if we're not moving a lot, especially in people with autoimmune problems. So like lymph massages are really great, or dry brushing is really helpful to get that lymph moving as well. And then emotional processing and trauma healing. I say everybody needs a therapist. So we all have some form of trauma, big or small, and it impacts us physically more than we realize. And then mind-body practices, of course, like meditation and, energetic spiritual practices are all supportive. So yeah, healing is possible. It's not linear. It doesn't happen overnight. And usually it's more like this, up and down, but usually always going up, right? We will have the dips, and our body naturally just wants to be in balance. It's trying to find homeostasis. And so what we want to do is focus on helping it get to homeostasis and not making it harder for it to do that. And functional medicine really just offers a roadmap to that slow, sustainable change and healing. Okay, so here at Ashtoria, we have functional wellness memberships and services. We're going to have some more focused programs that will be coming out soon, some that are more focused on like hormones, autoimmune, and some weight management and optimization. So that's exciting. We also do functional psychiatry. I love psychiatry, love mental health, and ketamine therapy as well, which is transformative. We offer that on our vibrational sound resonance bed as well. So it's like a double whammy healing. And then, of course, we can do all the functional lab tests, do supplements, IVs, nutrition coaching, and then our little workshops that we have each month. And then hopefully soon we'll be doing some more community events as well and collaborating with some other healers out there. So, question.
I think I know the answer.
Okay.
But insurance, is it coming?
Does not.
But
Yeah.
if you give them an ICD code, could they not just file it themselves?
No, not really.
See,
Because you still,
it's just like when I took mom to West Cancer Clinic. I asked about multiple tests. And they said, no, we can't do those. They don't have access to them. So it's kind of governed by, you know, our FDA, insurance, big pharma. Functional medicine tests that help find the root cause does not align with what they do. So most labs don't even do those tests. Like where we're getting our functional medicine tests, you know, they come with a mailer, like either UPS or FedEx, to get them to a lab out of this area. They have to go to actual functional medicine lab test places, you know, like businesses, because not every lab does the functional medicine test.
yeah.
So it's kind of crazy. I mean, insurance is biting themselves in the foot, not allowing people to heal, but insurance is also, you know, it's run by the other parts of big medical.
Yeah.
So if you truly want to heal, it's out of pocket.
Yeah.
If you want to take a Band-Aid pill for the rest of your life to not heal, but to manage the symptoms while creating other symptoms that you'll need other pills for, insurance will pay for that all day long. So it's just the world we live in now.
Well, and I think you have to think of this as an investment and like what you're going to get out of it. You know, hopefully a lot healthier, longer life. But that's hard when you're already paying for insurance and you kind of have to have insurance. You know, what if something happened and you have an accident? So, you know, one option I know that a lot of people do that see functional medicine practitioners, they just have like the catastrophic insurance. So if something happened, you know, hospital wise, like you wouldn't be out a lot of money. And you often, even just at traditional places, you'll get a certain percent off of the services, you know. But then you're saving a lot of money and you can invest more of your money in what is actually going to help keep you healthy. And
I need to try to remember who it was, but just this past week, somebody told me that they tested for heavy metals and insurance paid for it. They had an ICD code, but you gotta remember too, different insurances do things totally different.
Yeah.
So let's just say, just because Blue Cross Blue Shield paid for it, doesn't mean United is. So it's not across the board. I'll try to find out.
And it's
I
not
remember
that you
who it
can't,
was.
like if you have the PCP, the basics like your CBC or your analysis, like those are certainly something that we want you to bring in if you have them. Because those are still the basis of what Leah's looking at.
Yeah.
I went ahead and did everything because I hadn't had any blood work in probably over 20 years. I hadn't had insurance in all I have is catastrophic.
Yeah.
I'm not gonna do it. Well, I'm not using it. Why am I gonna do it? And if something happens, it's like even doing all this. And I just thought about it. I hadn't got a bill yet from Dr. Maydell, and they do not have my insurance information. I'm gonna have to check with him about that. But anyway, like when I'm doing my MRIs and all that, Medicare will pay their part. I still pay the rest. I don't even have like an extra Medicare. like everybody has like, oh, they'll pay the 20% and all that. I just have what I'm required to have, and that is all I do. It still is 100% cheaper than me paying for insurance every month.
Yeah.
I'm not gonna do it.
Mm,
Well, I ran up against that with Medicare this week because they're not paying for, I went to the eye doctor and, the gynecologist too. And their Medicare's not paying for it because it's wellness. They said, oh, they'll pay for it if you're sick, but they don't pay for wellness things. I'm like, are you crazy? And she goes, yeah.
Medicare more and more is getting to the point where they are making it very clear they don't care about our quality of life. They really don't care about our quality of life, and if you turn 80, forget about ever trying to get
Yeah. You won't get
anything,
Yeah.
like it's like they think you age out of
Yeah.
the ability to have a quality of life, they don't want to operate on anything past 80.
Yeah, and I think that's.
And we've
so
been paying
crazy
for all of our
because
lives.
right, for
every
what?
day People are living more and more to 100. That's 20 more years.
Yeah.
I'm not saying everybody will, but that's a lot of time there to be cutting them off
Yeah.
early.
Mm-hmm.
So I'm gonna talk a little bit about peptides. I'm not gonna get into it
Yes.
super deep because
Just take just a breather.
Oh, yeah, yeah,
Just
yeah.
real quick.
you can pause it, right?
Okay. Yeah.
She'll stay here with you, so I can just run. I could do it with her, but
But I pulled just some peptides that are specifically good with the autoimmune condition. So peptides are just short chain amino acids, which are the building blocks of proteins. We have peptides in our bodies naturally, but as we age with disease and so, we don't, they get destroyed, don't have as many, don't make as many, whatever. So being able to put these peptides into our body is pretty amazing.
Yeah.
So for autoimmune, we have peptide LL37. It's an antimicrobial and I always have trouble with this word, immunomodulatory.
You got it.
Pretty good one.
You did good.
Enhances the body's defense mechanisms against infection, reduces inflammation, and promotes wound healing. Chronic inflammation and infections are one of the big things with autoimmune. So that's a great one. And then BP 157 promotes healing of the gut lining, which is another big key. Reduces inflammation, supports tissue repair, crucial for syndromes like Crohn's and ulcerative colitis. And then also TB 500, and we can often get BP 157 and TB 500 mixed together. Those are compatible to mix together. That also reduces inflammation, promotes wound healing, regenerates tissue to relieve a lot of the symptoms of autoimmune diseases. And then there's thymosin alpha-1. Improves immune response, reduces chronic inflammation, helps restore immune balance, beneficial for all autoimmune conditions. And when you pair this collectively with SS31 as well, it also, SS31 reduces oxidative stress and inflammation while protecting mitochondrial function, beneficial for managing autoimmune diseases. And those two go really well together.
Once a day or twice a day?
They're gonna be all different and depending on the client. So there's no one right thing for everybody. Excuse me. And then we have tirzepatide, which is more known as a weight loss drug. But it does that by improving insulin sensitivity, helps with metabolic health, which can reduce inflammation and manage autoimmune conditions as well. When you have a lot of inflammation going on, when you feel horrible, I feel like weight gain very often goes hand in hand with that because their insulin sensitivity is messed up. And that goes into metformin, which we all know as a diabetes drug. I'm hearing more and more functional medicine doctors out there saying they think everybody should be on a small dose metformin because of how it improves the immune regulation, showing support for severe autoimmune diseases, also reduces inflammation. I would rather use personally something like a tirzepatide for my insulin sensitivity than the metformin, because the metformin is not a peptide, it is a drug. But easy for a lot of people to get, it's
Yeah.
pretty cheap.
Yeah.
There was a study, in Cell Death and Disease 2019. The study demonstrated that metformin reduces inflammation and improves immune, regulation by activating the APK, autophagy pathway, showing its potential in improving autoimmune disease. But I feel like we've got peptides that do the same thing. So it's really just one more thing that we have in the toolbox. If someone can't afford the peptides, that might be a fallback. But peptides, oh my gosh, I sent up some BP 157 and TB 500. My dad, who his knees have been shot ever since he was put on, statin drugs and blood thinners. He did his first shot Monday morning, and my brother said within an hour he was moving better. I don't know if that was a placebo effect, if it really worked that fast, but I'm having him do that every other day to see if it will help, because TB 500 and the BP 157 together are incredible for
Yes.
helping bone, cartilage, muscle, tendons, like everything around a joint. It's just amazing. And you can shoot these in your belly, in the fat, or you can shoot it right around the area that's hurting you. So I'm having it do it right in his knee where it's hurting. So, and I just hit mine this morning for the first time.
Yeah.
Yeah. And I put it in both because I put it right in this little fatty pocket.
Yeah.
Right in the center. Because my brother said he only did it in his right knee. And he said it feels so much better. Now he's feeling his left more. And I'm like, well, just have him do it in both. Because I know they're both, degenerated.
Yeah.
So.
Wow.
But these are really, really exciting. We've got peptides for everything now, for brain health, for lengthening our telomeres, the weight loss.
Yeah.
I love the ones for cognition especially, but
Yeah.
even just for mitochondrial health and
Like the NAD too that we're doing.
yeah. There are literally hundreds of peptides out there.
Yeah.
It actually goes into thousands, maybe even tens of thousands. I heard some scientists say some ridiculous number, but the ones that we're going to be dealing with will be like 100 or so probably.
Yeah. Amazing.
But these are pathways that are actually helping us to heal, not just throwing a Band-Aid on it. You're going to have to take it forever. In fact, most of these are going to cycle on and off when needed.
So the next slides, you're gonna be going in more detail with all that. With everything.
So, and we have to be careful. I can't put out dosing or anything like that until someone's a client, because you can get in a lot of trouble for that.
Yeah.
But I can still explain about what each one is and what they do to give people a more broader understanding of them.
Yeah, as long as the FDA or whatever.
And we're getting all of our peptides from, I don't know the acronyms, but they're all FDA approved labs.
Yeah. 503 C whatever B A.
So legit, like you want to get them through legit places, and you have to have a NPI to get them. Now you can buy some cheap peptides online, but they're going to be coming from China, and you're not going to know what's in them. Very dangerous. Yeah.
Did you check into where Lucy was getting hers?
She gets hers. She was getting hers from a compounding pharmacy in Florida, but the FDA has really come down on them. Most of them they
Before
can't.
that, she
They
had a
can't.
company she was getting it from.
They
Because
can't.
when she started doing them, I was already doing them. But my company was different, but they were a little bit less, but it wasn't from China. It was a more of a program where they were doing, it was all about weightlifting and all that, but they had the peptides and it was cheaper. And then she had hers, but she wasn't, because this other was fairly new company, and it was mainly about, they were pushing a lot about weightlifting and all that. That's what it was all about for them. She liked the other one because it had, hers cost more. I'll find out what they were and let you know.
Well, we're getting ours direct, so we're not going to go through the bodybuilding company. Most of theirs are coming from China.
Oh,
They're
really?
just private labeling them so that they can sell them with their programs.
Oh.
We're not private labeling them, we're just, when people are in our memberships, that's a perk. We're giving you all of those functional medicine tests
And
at our cost.
Yeah.
Most places quadruple it.
Do you know how long they're good for?
What's that? The peptides?
Yes, they're all just, I guess,
The
birthday
peptides
dates.
are gonna be a little different, also depending on if you want them reconstituted or if you want them in dry powders, because the dry ones that aren't already reconstituted when they come to you have a 2-year shelf life. And once you reconstitute them, they're good for 90 days. The ones that we've gotten in that we first got into trial were already reconstituted, they're only good for 30 days.
Mhm.
I kind of like getting the
Always
dry
got
ones and
powder,
makes
yeah,
them fresh because they don't
Right.
have to have the preservatives in them.
Yeah.
right.
And I
Yeah,
like
I
them
always
as
got the
clean as
powder and then
possible.
Got
Yeah,
them ready to get myself shot, you know. So if they're more than 2 years old, just trash them all.
mhm. I mean, I don't know the answer to that technically. I don't know if like with a lot of medications, it's not that they're gonna go bad, but they might be less effective. I don't, I'm not sure. We'll have to ask one of the labs about that.
Oh, but
I'll look and see. And
they should have an expiration date on them, shouldn't they?
yeah, but I think it being powder, I mean, everything has expiration
Yeah,
date. I mean,
yeah.
but, I mean, it's like rice. Rice does not have an expiration date,
Yeah.
okay? Rice will be here after we're all gone. All right.
As will honey.
Right, exactly. So I don't pay attention to a lot of that stuff. I use my common sense.
Yeah.
You know, the apple's gonna have expiration.
Yeah, for
Okay,
sure.
but being, now if it was constituted, that's a whole nother ballgame.
Yeah,
But it's not constituted, it's just the powder.
right.
Why would the powder have expiration date? Really, you know, I mean, I don't know.
I have another question.
I'm just learning.
Clean water, what's your definition?
My
Of
definition,
what?
clean water.
Cause I drink alkaline water,
I do too.
That's what you do.
alkaline water.
Val, what is your definition of clean water?
It doesn't come out of a plastic bottle.
It doesn't come out of the faucet
Yeah,
unless
Yeah.
it's got a filtration system on it.
yeah.
You know, I'm not sure we have such a thing as clean water on Earth anymore, to be honest with you. You know, unless you're up in the Swiss Alps or something and you're catching clean mountain water, but even then there's goats running around. So I don't,
Yeah, the best thing is
So-
filter.
Yeah, I think a really good filter.
I like personally reverse osmosis with a remineralizer on it.
Yeah.
Because nothing will get any water cleaner than reverse osmosis. But the problem is it also takes away all of our electrolytes and minerals. So you need to put them back in your water after that. So like the system I have under my sink has that remineralizer on it, so.
Yeah.
I don't have all
Is
that.
there-
I just have a tie-up water filter that
A
takes all of
brand
that
or
out, but it'll have normal water or 3 different levels of the pH. And it's see, like right now, dealing with it, I'm doing pH 3, which is the highest you can do. I mean, it's, you use 2 for like coffee and teas and stuff like that. It makes it less acidic for people if you'll make your coffee and tea with that. But the normal one most people will drink for the high pH would be 1. But then you don't want to be drinking anything that's high pH if you're taking pills because they don't work. I don't know if you know that. Do y'all know that? Okay. You have to have just basic water. But I thought Fiji and there were a couple of others were good. When I've done the research, no. The only, if you have to get something, get a spring water.
Mhm.
That's gonna be your less evil, but your best just to have some kind of filter or system like she's
Yeah.
got.
I just like, I do occasionally drink bottled water when I'm traveling and stuff, but it grosses me out, cause all I can think of is I'm drinking microplastics, I'm drinking
Yeah, same
microplastics.
here, yeah.
And I don't care if they say no BPA, you know, they replace that with some other toxin,
Yeah,
so.
yeah.
Mhm.
It's in everything now. you
Yeah.
know, As far as all of that, best thing to do is just get your things and get your own water from home, bring it with you.
I used to drink so much bottled water. It really kind of sickens me now that I did.
I don't know if you've ever noticed stores that have, or gas stations that have sodas and waters bulked out outside in the heat in the summer.
Yeah.
Like, we went, I forget what island we were on, but we we're on an island vacation somewhere. I was eating so clean. I was getting nauseous and sick. And I told my husband, I'm like, I think it's the bottled water. And he thought I was crazy. I said, no, I think it's the bottled water. I bet it's gotten hot because I feel like I'm drinking plastic.
Mm.
We went downstairs a little while later. Lo and behold, timing, a guy had opened up the locked closet underneath the stairway outside, and he's pulling bottled water out from underneath the stairs in like 100-degree weather
Yeah.
to put up in our cabins for our clean drinking water. I don't normally drink a lot of alcohol. Like, I'm very sensitive to it. I stopped drinking water at that point. I started having juices and beer, just a light beer. And I didn't have trouble the rest of the vacation. That water was making me sick.
I can believe it.
Mhm. Dang.
Yeah, I'm very sensitive. I can
Yeah.
feel it pretty immediately. Because it's probably with the toxins in it, very
It is.
acidic. too.
Yeah.
And
It
people
just
shout
my
out,
stomach up.
oh, the Fiji water, that's supposed to be the best. I can't remember what the other one was, and I was reading all about
And I
it.
do like the taste of that.
Everything.
I do
Well,
too.
I do too, but when you start looking at it, it's got all the toxins as well as the plastic, but it's not as pure as what it used to be.
Huh.
It doesn't even come from Fiji.
Lies, liars,
When I read
false
that,
branding.
I was like, seriously? I mean,
But that is so true. Like, so many products when they started out
started out good.
with the original creator, if you will,
Mhm.
being so clean and healthy, and then they sell it to a bigger corporation and it's adulterated.
All right.
Yeah, for
Yeah.
money.
Yeah. This is really
Yeah.
sad.
You gotta
The
check
money.
everything, but hopefully the world is changing and it will slowly some of it will be done along with us doing our own due diligence that we can make some good.
Yeah. Yeah.
I think with more and more big doctors turning to functional medicine and the biologists and everybody, really getting big on social media,
Mhm.
that more and more people are getting to know about functional medicine. We're still in a dead zone here. We've got a lot of educating to do and sharing with people that we're doing this, because I don't know of many people that are really doing functional medicine around here. We've had several, from what I heard, good functional medicine doctors, but they couldn't get traction quick enough and they ended up moving away.
Mm.
And there are some that say they're doing functional medicine, but one of them put a pharmacy in her practice. To me, that's not functional medicine.
Mhm. Yeah. Yeah.
They're using it as a buzzword, but they're not really trying to
Yeah.
heal.
They're
Yeah.
not trying to heal.
Well, it's more like the wellness, weight loss, hormones. You know what I mean?
And I don't call using the mega doses of Ozempic and Wegovy functional medicine.
Oh, God.
If you're gonna do weight loss right with peptides, you microdose them with other regenerating peptides, so you're not having muscle wasting,
Mhm.
so that you're improving your health while you're doing it. Because those are peptides we have in our body anyway. If you microdose them to get them to a normal level, what we've seen in the industry is a macrodosing, it just bam, 2.55, 10 milligrams, give us 800 to 2 grand a month, and people get emaciated because they're dropping weight so
Yeah.
quick.
And
Yeah.
then they can't get off of it,
Yeah.
Yeah.
once
Yeah.
they start taking
But
it.
microdosing is slow and steady, and it can actually help improve your metabolic function
Yeah.
at the same time. A lot of these are also very heart protective, because of all the things we're fixing
Mhm.
and regenerating tissue.
Well, and what
I'm really excited about these.
Yeah, they are really exciting, and how we really want to treat people. And I think the right way to do it is everybody's going to be individualized. So, like, for us to advertise, oh, we're doing semaglutide, you know what I mean? Like, we're not really trying to attract the people that are just looking for the quick fix, because it's not like,
It's not.
no, right. So that's another part of the education that has to happen, yeah, to get people, because
It's like, do you want to get well or do you just want to just get by?
well, right. But it takes a lot of work to get well. You very well know that, to really get well. And so we've, just gotten lazy where we just want, give me the pill,
There's a lot of work to it, but I mean,
Yeah.
it pay off in the end.
but it's worth it.
Yeah, absolutely.
Feel like a just different person. Yeah.
Be a different person because you feel good for once.
Right.
Definitely. And the peptides are awesome. I know they are, but they do end up getting pricey when you start keep adding. I think when I finally stopped, I was taking 6 different ones for different things. But I only did it for about a year. I couldn't keep up with the cost.
I think too, there's a benefit to just focusing on a couple at a time
Mm-hmm.
and cycling them.
Mm-hmm.
And that way you can really feel if that particular combo is working for
Yes.
you. Like I think I kind of OD'd myself, but I'm using myself as a good thing. Because I think I was using like 6 at one time.
Yeah. Val's like, I have a headache, my stomach's hurting, like.
You basically kind of mix them up, you said, combo.
I started,
Cycling.
not doing it every day, like I'll do